Cameron, let's talk a little bit about braces now, because I didn't know, and I'm sure there are people out there who don't know, that you guys actually do braces as well as just general dentistry here at Aspen.
Yeah, for sure. I mean, we do all kinds. The regular braces that you're familiar with braces, and also those Invisalign or those clear tray aligners. There are a couple of different ways to do that, but we do all of it. It just depends on what a person needs, what type of movements we're trying to do with their teeth, their age, all those factors. But yeah, that's definitely something we can help people with.
So specifically for children, when do we need to start thinking about braces for children? Is it something that happens overnight, or are you able to catch it along the way?
You can usually catch some of the risk factors, right? Whether it's they had all their baby teeth were really tight together, and so they may not have enough space for all their permanent teeth, or one of the biggest things we actually deal with that I didn't think of before when we were talking was it's also how we take care of teeth that when they have a tooth that may need to be pulled or needs some major treatment, how do we maintain the space they have? Because one of the biggest problems we deal with when we're doing braces is we're trying to compensate for the fact that a tooth was lost prematurely and that space wasn't maintained, so teeth have drifted, and then there's more work involved in doing the braces.
Everything else more difficult.
Yeah, so it's everything from watching the health of their teeth, keeping every tooth we can in there, or maintaining the space of a tooth we lose, and then there may be something if their jaws, one jaw is a little undersized, or we need to do some expanding, that we may start an appliance of some kind at age 8, maybe 9, and then they have a retainer of some kind, and then most kids are going to start braces around 12. Okay, give or take, depending on when all their permanent teeth come in. But there are sometimes things that are beneficial to do beforehand.
Okay. Typically, how long do they stay in? Does it depend? I suppose each case stands alone, right?
Yeah, I mean, a good average you can say is probably about 2 years. Now, if they lost teeth prematurely and the space wasn't maintained, that's usually going to lengthen the treatment. Can we keep all their teeth? Do we need to pull some teeth? There are a lot of variations there, but you can usually say around 2 years. Some are a lot faster, some are a lot longer. Yeah. So that's a good ballpark.
Okay. I'm sure a lot of parents look at braces and think, oh, there's no way that we could afford those, but you have great payment plans these days and options, don't you?
Yeah, for sure. So anytime when you're doing braces, there's usually something that you do pay up front. As we get started, we take records and all of that and plan the case, and then it's usually paid over the course of the treatment, and then you're paid off before they come off. That's pretty standard for any office, orthodontist or general dentist that does braces.
Right, and that's a great option, really. There's really no excuse these days for people to be walking around with crooked teeth, is there?
Yeah, I mean, there are definitely options, and there are things we can talk about with parents, and everyone's got their own concerns, but there are definitely ways we can make it easier.
So if your child needs braces, or indeed if you yourself need braces, why don't you come in and see Dr. Cameron here at Aspen Dental? They will help you out. Thanks, Dr. Cameron.
You bet.